Today I'm going to talk about pneumonia, but first we need to go over the respiratory system. The respiratory system has many moving parts, such as your nasal cavity, which helps warm and moisten the air, and also helps filter it. You've got the oral cavity, which is a secondary way to get air down into your lungs, paranasal sinuses, which also help humidify the air, the pharynx, which is responsible for taking the air from both your nose and your mouth and directing it towards your larynx, which is how I'm talking to you now since it houses the vocal cords. This is responsible for making the air go through your trachea. And this is where it starts to get a little crazy, because then it's going to go into your main bronchi, which split off into numerous branch-like structures in order to get enough air into both your left and your right lung. A fun factoid you might enjoy is that the right side lung has 3 lobes instead of 2. Pop quiz. What are the 2 portals of entry that are most common for pneumonia? Thinking about it. If your answer was the nose and the mouth, you would be correct. At the ends of the bronchi, there are little structures called alveoli, and these are responsible for the carbon dioxide and oxygen exchange for your blood. In a healthy person, as shown on the left, all of these things take place as they should. It's important to note that there are lots of ways that you can develop pneumonia. You can get it from bacteria, fungi, viruses, aspiration of food or water. There's many ways that you can develop this sickness. What can happen on the inside of the body is that the bronchial tubes become inflamed, making the opening, the air passageway, much smaller and more difficult to breathe through. On top of that, it can also fill up with pus, making it even smaller. Imagine breathing through that. It can also affect the alveoli, usually does, making them much smaller as well, and also filling them with fluids, which makes that gas exchange between carbon dioxide and oxygen very difficult for your body to do. Now, on the outside, this can present as fever, sweating and chills, chest and abdominal pain, confusion or an altered state, fatigue, loss of appetite, bluish lips or skin, and, of course, shortness of breath. Pop quiz. What is the correct PPE used for pneumonia? Thinking about it. If you said droplet precautions, which includes eye protection, a mask, a gown, and gloves, you would be correct. With pneumonia, there are 4 stages of infection. The first stage is referred to as the congestional stage, and this is the initial infection when your bronchi begin to swell and fill with fluid as well as your alveoli. The second stage is referred to as red hepatization. This is when the alveoli begin to fill with neutrophils and red blood cells. The third stage is gray hepatization. This is when the red blood cells start to die, leaving gray exudate. The fourth stage is the resolution. This is when the body rids the infection and everything starts to clear up. While healthy adults can usually beat pneumonia within 1 to 6 weeks, complications can make this a much more difficult infection, such as older adults or young children, immunocompromised individuals, or people with chronic conditions. Other possible complications are respiratory failure, sepsis, acute respiratory distress syndrome, and a lung abscess, which can sometimes require surgery. The heart and lungs work very closely together, so a severe infection can often leave lifelong impacts on the heart. Pneumonia is actually one of the most common causes of sepsis, and in certain very severe infections, it can also very negatively impact the kidneys. Which leads to something I find pretty interesting, is that pneumonia can actually be diagnosed through a urine sample. There are many CNA interventions we can do to help, such as frequent ambulation, which helps prevent further complications associated with pneumonia. Guided coughing can be crucial for helping secretions exit the lungs. Proper positioning can help eliminate some of the strain that coughing puts on the body. Another intervention is frequent repositioning, as this can also help move mucus. Orthopenic position is pictured and helps you take bigger breaths as you have more lung capacity in your back. Prone position is also very helpful considering that the weight of other organs is no longer compressing the lungs. It's important to ensure that proper breathing etiquette is being used. Breathing through the diaphragm helps ensure that the lungs fully expand. One intervention is to monitor vital signs. This is a very important intervention with pneumonia specifically because of how quickly it can escalate into other very, very deadly things, such as sepsis. It is also very important to ensure that your patient is drinking lots of water. It helps thin up the mucus and make it easier to cough out. That was a lot of information. Now take a proper deep breath, really breathing into your stomach and using your diaphragm. And thank your lungs.